What is dog syringomyelic? Have you ever noticed your dog acting strangely or seeming to be in pain without any obvious reason? One condition that might be at play is dog syringomyelic. So, what exactly is this condition? Dog syringomyelic is a neurological issue where fluid-filled cavities, known as syrinxes, form in the spinal cord. This happens due to abnormal flow of cerebrospinal fluid, often linked to a structural defect in the skull called Chiari-like malformation. In this situation, the back of the skull is either too small or oddly shaped. This leads to crowding at the brain's base, disrupting normal cerebrospinal fluid circulation. When this disruption occurs, it creates pressure changes that can cause syrinxes to develop, potentially damaging nerve tissue. The most common sign of syringomyelic is pain. Dogs may vocalize spontaneously, show sensitivity to touch, or engage in unusual behaviors like scratching or rubbing their neck, face, or shoulders without making contact. This behavior is sometimes referred to as phantom scratching. You might also see your dog excessively licking their paws or being reluctant to exercise. Pain tends to worsen at night, during temperature changes, or when the dog is excited. Some dogs even adopt specific sleeping positions, like keeping their head elevated to ease their discomfort. Neurological symptoms can vary greatly. While some dogs may show no symptoms at all, others can develop progressive issues such as weakness in their limbs, coordination difficulties, neck stiffness, or even seizures. The severity of these symptoms can differ widely. Some dogs may experience mild signs for years, while others could become severely affected in just a few months. Syringomyelic is most commonly found in certain breeds, particularly Cavalier King Charles Spaniels. Signs often appear between 6 months and 3 years of age. To diagnose this condition, veterinarians typically use advanced imaging techniques like magnetic resonance imaging to visualize the syrinxes and assess the skull and spinal cord anatomy. Managing syringomyelic focuses on controlling pain and improving the dog's quality of life. Treatment options may include medications to reduce cerebrospinal fluid pressure and inflammation, pain relief medications, and sometimes surgery to correct the underlying skull issue or improve cerebrospinal fluid flow. Since this condition can be chronic and progressive, regular veterinary care and monitoring are essential. Pet owners should be observant of any changes in their dog's behavior or mobility and consult their veterinarian promptly if symptoms worsen. Understanding dog syringomyelic is important for early recognition and effective management. With the right care and attention, dogs with this condition can lead fulfilling lives.